Good evening to all. Today is the World Brain Tumor Day. I am Dr. Jayesh Sardhara, the Senior Consultant Neuro and Spine Surgeon, Fortis Hospital, Mulud. I am also the minimal invasive neuro and spine surgeon. On this occasion of World Brain Tumor Day, the idea is to increase the awareness of the brain tumors, the challenges in the management of the brain tumors, the challenges to cope up all the stress related to the brain tumors. We'll discuss about what are the myths in the societies regarding the management of brain tumors and how advances in the current era the brain tumors treatments. So brain tumors are the huge challenge actually to manage. If we, if we say incidence, the International Cancer Registry says that there are 28,000 patients per year diagnosed as a brain tumors, and it is more common in India also. So overall incidence is 5 to 6 cases per 1 lakh population of the brain tumors detected in the India. Compared to adult, children is more common. In the children, it is the second most common cancer of the body. I'm talking about the brain tumor. Why it happens? Commonly it happens because of genetic mutations. जैसे हमारी बॉडी में 23 pairs होगी, then there is a spontaneous mutation of one of its pairs because of protein shifting. Then there will be a sequence reaction and then brain tumors develop. There are some myths that brain tumors occurs because of mobile radiations, alcohol, head injury, laptop reactions, but it is all are the myth. Brain tumors occurs because of genetic mutation. Sometimes it is hereditary also. किसी को family their family में भी continuous run करता है, that is 30% cases. Sometimes very rarely it also occurs from the radiation. So there are two type of brain tumors. One is benign tumor and other is malignant. Benign tumor is approximately 70%. So malignant, it means we are saying cancer. It is comparatively very uncommon. So other myth is that एक बार किसी को brain tumor diagnosed हो गया, then life is end. There is no cure. It is the myth. In this advanced era of management, we have all the uh, very modern, we can say, neuroscience, which give you a complete comprehensive surgical, post-operative adjuvant chemotherapy and radiotherapy treatment, and it is curable. Some of the malignant tumor like glioblastoma, which is comparatively occur after 40 to 70 years of age, which is cancer. It has also a stage 4 stage 1, 2, 3, 4. Out of that only the stage 3 and stage 4 is, we can say, more cancerous. Remaining tumor is also still curable. So if we say benign tumor, so benign tumors are the meningioma, craniopharyngioma, vestibuloschwannomas, which are the very common. Low grade glioma like stage 1 and 2 of glioma is still benign tumor, and malignant tumors includes glioblastoma, which is very common. So अदर क्लासिफिकेशन इज प्राइमरी एंड सेकेंडरी. अगर ब्रेन में ही डायलेक्ट ब्रेन के किसी पार्ट में ही सीधा डिटेक्ट होता है, डायग्नोस होता है फर्स्ट टाइम, वी कॉल्ड प्राइमरी. कहीं और बॉडी में किसी और ऑर्गन में कैंसर है और वहाँ से ब्रेन में डिटेक्ट होता है, दैट इज कॉल्ड सेकेंडरी और मेटास्टेसिस, which is having very poor prognosis, that is 6 months to 1 year of stage life. पीडियाट्रिक एंड एडल्ट क्या डिफरेंस होता है? In pediatric tumors, the most common, the age group in which tumors happen, that is a medulloblastoma, which commonly occur at the 5 years of age. Other is the brainstem glioma, ependymoma, meningioma. These are the common tumors occurs in the children also. And yes, majority of them are curable. So how it present? What are the symptoms? How should we detect it? So common, the issue, most common symptom is a headache, and even recently WHO data and literature says that somebody who has a continuous headache more than 6 months should definitely undergo a NCCT, at least CT brain. सिटी स्कैन ब्रेन को बिल्कुल कराना चाहिए, बिकॉज द चांसेस इज ऑल्दो लेस देन 1% कि उसमें कुछ हमें मिल जाए, डिटेक्ट हुए, बट इन दैट केस, because it is very early detection, life can be saved. Other symptoms, common symptoms are seizures, leg weakness on one side, particularly one side of hand, one side of the leg, and headache is particularly of morning rising headache, morning rise headache, severe headache, but सुबह के time होना. After headache, 2 3 hours headache, there will be a vomiting. Sometimes it is also associated with the visual loss on one side or on other side, partial vision loss. It's also sometimes brain tumors presentation. Then there is a vertigo, vestibular schwannoma, in which they usually present with a hearing loss and vertigo. Imbalance, पीछे के दिमाग वाले सारे ट्यूमर्स imbalance के साथ प्रेजेंट होते हैं. Then sometimes there is a numbness, night pain, memory loss. These are the some signs and symptoms. कई बार अगर ब्रेन ट्यूमर्स बिनाइन नॉन एलिक्वेंट एरिया लाइक आगे के पार्ट में फ्रंटल लोब टेम्पोरल लोब में होंगे, तो समटाइम्स it may prolong for 5 to 10 years, and it can be detected after 10 to 12 years in incidental investigation, like किसी और चीज़ की वजह से हमने एमआरआई या सीटी कराया और सडनली ब्रेन ट्यूमर डिटेक्ट हो गया. These are called incidental finding. They are usually benign and curable, so no need to worry for that. Now, why these brain tumors causes symptoms? Because normal हमारे skull के अंदर brain and blood tissue and CSF के अलावा there is no space for other things. If something like brain tumors grows, then it increase the brain pressure, increase the skull pressure, which is causing all the symptoms. The CSF circulation would be stopped because of brain tumor, और उसकी वजह से पानी का प्रेशर बढ़ जाएगा. We call it hydrocephalus. Sometimes brain tumors के अंदर भी hemorrhage होता है, तो patient may present with the seizures and sudden headache and weakness because of hemorrhage in the brain tumors. Sometimes visual loss because of nerve compression is also proper problem. So, how to diagnose it? So, the most common the radiological investigation once we detect that patient might have a tumor is the MRI. We do MRI brain with contrast, because tumor take up the contrast because of उसमें blood reactivity ज़्यादा होती है. So we do MRI brain with contrast. Now in this advanced era, because we also supposed to do a surgery, so हम लोग MRI की sequences different sequence में कराते हैं, like MR spectroscopy, MRI diffusion weighted image. We have a neuro navigation. So that is a different sequence जिसमें हम during surgery हम brain tumors को 3 dimensional में operate कर सके. So it's called neuro navigation protocol. Sometimes with the seizure we do epilepsy protocol. So we do MRI in the different sequences, which is very advanced and helpful for the better outcome. Then again, with the all routine investigation, we post for the surgery. So once we diagnosed, the plan is to surgery all the brain tumors, irrespective of the benign or malignant. The treatment is complete surgery. There is no alternative of surgery. Sometimes if tumor is less than 3 centimeter size, very small tumors in the beginning, then there are the option of gamma knife. There are the option हम बरहोल करके छोटा सा बायोप्सी ले, यानी बायोप्सी सजेस्ट of very high grade tumor or very curable tumor by chemotherapy and radiotherapy like lymphoma, then yes, surgery can be avoidable, but these are very rare alternative. But the standard treatment of brain tumor is the surgery. It's a very safe surgery. Now, if there is a benign tumor, we remove it and it is curable. Recurrence will be very late after 20 years, 30 years, and which is very rare. Malignant tumor like glioblastoma, we do maximally safe resection and उसके बाद chemotherapy and radiotherapy for 4 to 6 weeks, which is the at-home treatment. Now, what are the recent advances in the latest era of minimalism? The recent advance in the surgery is a minimal invasive brain surgery, so which made it very, very, very safe. Like, give you the example, uh, we do just in the previous era we do craniotomy, so skull flap निकाल के uh, we remove the tumor. Now, because we have a high-ended endoscope in this era, so we just do a small burr hole less than cone shape, and with the endoscope we can go for the surgery, and that is possible, called minimal invasive brain surgery. We call keyhole surgery. So majority of tumor it can be removable. For so all the surface tumor like gliomas, meningiomas, intraventricular tumors, it can be possible, like colloid cyst. Those tumors which are at the skull base, like skull base meningiomas, bony tumors like clival craniopharyngiomas, the other type of minimal invasive surgery is transnasal नाक के द्वारा endoscopic tumor excision, which is incisionless. There is no incision in the body, and it is possible. So, what are the advantage during surgery? There is no pain. There is a yeah. So Gaurav Yadav is asking if the current option available for the brain tumor patient. Yes, exactly. I am talking about. So current option is the surgery, which I am talking about. The advance is the minimal invasive brain surgery. In the minimal invasive brain surgery, we are talking about the endoscopic surgery, transnasal endoscopic surgery. How we do that? So we have a neuro navigation which exactly tell you before surgery and during surgery that where is the tumor we can best approach, and exactly at that time we can put a burr hole there rather than a whole craniotomy. Other is, we suppose brain tumor is nearby the visual area, nearby the speech area, nearby the motor area. In that case, the chances of weakness will be high after surgery. But how we do that? We do awake craniotomy. Patient will be awake during surgery. Suppose patient को the tumor है in the motor area and there is a chances of right side weakness. So what we do, patient remain awake during surgery. We ask the patient, we can talk with the patient and ask the patient to counting and finger movement. So during surgical removal, if we find there is a weakness in the hand or patient stop the speech, तो हम we stop the surgery or we do alternative. This how we can manage. The other alternative and the recent advance is अल्ट्रासोनोग्राफी हम यूज़ करते हैं, सो हम मैक्सिमम ट्यूमर निकाल सके और हमें ये भी आइडिया रहे कि कितना ट्यूमर छूटा है और कितना ट्यूमर हम अभी बाद में मैनेज करना पड़ेगा. So these are the recent advances in the neurosurgery. Gamma knife is also good options before the surgery and after the surgery. If tumor is less than 3 centimeter or if there is a large tumor, we had left the tumor at just 2 centimeter or 1.5, less than 3 centimeter. If we need to left somewhere to prevent the neurological damage, gamma knife is good option, which is basically a kind of laser, is a gamma rays to the tumors which damage its nucleus. Linu Albert is asking if BP tablet started can be stopped later on. Yes, pre-operatively we manage antihypertensive. On the day of the surgery we manage the hypertension or the blood pressure uh, by the help of anesthetics during the operation table, and on the next day even again we start the antihypertensive tablets, and patient can take it continue for the further hypertensive treatment. It has nothing to do with the direct relation with the brain tumors, and that's all. So it is usually comorbid condition. So brain tumors का management अलग होगा, hypertension का अलग होगा, and you can continue pre and post surgery. Now the next step is after surgery. So usually the advantage of, as I told you, if you choose the keyhole endoscopic surgery or transnasal endoscopy, you can discharge early because there is no chance, very less pain, less infection, incision is less, so you can discharge usually on day 2 or day 3 or day 4. If the biopsy take 5 to 7 days, if say it's suppose benign tumor, then there is just a follow-up required. Usually do MRI brain contrast after 3 or 6 months. If there is a biopsy came as a carcinoma, like glioblastoma, like the malignancy. In that case, we refer the patient for chemotherapy and radiotherapy. So chemotherapy, now again I come to that one. What are the latest advanced treatment options available which increase the survival of the life? अभी जैसे कि glioblastoma patients, their usual survival is 14 to 16 month after surgery, but there are the latest innovative latest research is going on chemotherapy and advanced radiotherapy, which may enhance the 5-year survival of the patient. For example, cell-based immunotherapy. First of all, why cancer usually not react to all these drugs? Why it is dangerous and why it is life-threatening? There are few mechanisms in which cancer grow. So we call glioma stem cells. कैंसर के अंदर ही पेरिफेरी पे ग्लायोमा स्टेम सेल डेवलप होते हैं, and that grows and which make a wall outside the tumor, which will not allow the various kind of chemotherapy and medicines to enter. There is a self एंजियोजेनेसिस मैकेनिज्म अपने आप ही वो चारों ओर से ब्लड लेता है, ब्लड सप्लाईज बढ़ाता है, अपने आप उसके रिसेप्टर्स चेंज होने लगते हैं, सो दैट ऑल द केमोथेरेपी बिकम मेक इट वेरी वेरी रेजिस्टेंस. पेशेंट्स की इम्यूनिटी डाउन हो जाती है, सो पेशेंट बिकम इम्यून टॉलरेंस. जेनेटिक वेरिफिकेशन स्पॉन्टेनियसली अपने आप होने लगता है. सो दिस आर द रीजंस दैट ट्यूमर अगेन बिकम रिकरेंस एंड ट्यूमर ग्रोज डिस्पाइट ऑफ ऑल द ट्रीटमेंट. So latest science says that let's attack on the immune tolerance. Let's attack on the gene therapy. So उससे काफ़ी benefit मिले हैं. Like cell-based therapy, temozolomide, very successful drug. So it is oral tablet, weekly लेनी होती है, and it takes for 4 to 6 weeks after chemotherapy, after surgery, and it has seen that the survival increase maybe more than 3 to 4 months compared to the previous way. Other immunotherapy is carmustine, and now it is very recent advance. After surgery, that carmustine wafers, which is immunotherapy, वो हम सर्जिकल साइट पे रखते हैं, उससे भी काफ़ी एडवांस सर्वाइवल इंप्रूव होता है. हाइब्रिड एनके सेल थेरापी, आई एम जस्ट टेकिंग अ नेम. मोनोक्लोनल एंटीबॉडी, ट्यूमर के अंदर बहुत सारे ग्रोथ रिसेप्टर्स डेवलप होते हैं, लाइक वास्कुलर ग्रोथ फैक्टर रिसेप्टर्स. सो to make monoclonal antibody which is against that growth receptor of the tumors, the main drug is bevacizumab. It's a monoclonal antibody, and it has a very fantastic results on the brain tumor uh, research trial. Gene therapy is still going on, brain tumor vaccine is still developing, but there are still in the phase 1 and phase 2 trial. Even in the USA, it is not FDA approval still date. So these are the latest therapy. So if I summarize, so again I want to fix it in the society, that I would like to actually emphasize on the awareness that brain tumor is curable. 70% of the brain tumor is benign, only few percent is the malignant. So don't think that if you detect the brain tumors, it is the cancer and it has no cure. It is curable. There are the options available in the medical science, like very very minimal invasive brain surgeries, which is very safe without deficits. There are the advanced chemotherapy agents which is available, which very help you despite if it is cancers. So no need to afraid. You are not alone in this journey, my friends. We are with you to help. And brain tumors never occur because of the mobile and the laptop and radiation space and alcohol and head injury. Usually occurs because of genetic mutations. I'm ready to give you the answer. This the basic overview I have given regarding the brain tumors and advanced management. I'm ready to help you to give to solve the query if you are put in the questions. on my personal link and Gmail ID also. My Gmail ID is jayesardara83 @gmail.com. Thank you so much. Yeah. So, Mr. Yogesh Moore is asking how many times radiation can be given to brain tumor in case of repeated recurrence. Yeah. So, for repeated recurrence of the tumors, like for example, there are various tumors, and like a benign tumor, if recurrence, again the next step is the surgery. If surgery is safely possible with a good hand, the surgery is the best option despite of recurrence. If there is a cancer like glioblastoma, then again we can give the dose of chemotherapy like temozolomide, and Bevec with monoclonal antibody can be repeated. The radiation can be repeated with minimal dose. Sometimes, we can use the gamma knife and other options with the focal radiation. Yes, it can be given. As far as surgery is possible, it would be the better option. Again, I would like to wish you all the brain tumor day, because I want to increase the awareness of the world brain tumors day. And I would like to thank you all for giving your attention, and thank you and good evening to all.